Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. My name is Afam, and I am a fourth-year medical student. In this video, we'll explore age-related macular degeneration, also known as AMD. We'll discover the differences between two types of this disease, wet AMD and dry AMD, plus what you can do to reduce your risk and how to cope if diagnosed. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or a medical condition. Age-related macular degeneration is the leading cause of vision loss in adults 65 and older. It affects the macula, the part of your eye that controls sharp central vision. You use your macula to read, recognize faces, and do many daily tasks. AMD usually does not cause total blindness, but it can make it difficult to see clearly in the center of your vision. To better visualize the struggle of the disease, here are examples comparing normal vision with age-related macular degeneration. The left side represents normal vision, the right side represents macular degeneration. As we age, the risk of AMD goes up. About 1 in 10 people over the age of 50 and nearly 3 in 10 people over the age of 80 are affected. Regular eye exams are important for detecting and treating AMD early. Your risk of AMD can be higher if any of these risks or conditions apply to you. You use tobacco now, have used it in the past, or are often around secondhand smoke. Quitting tobacco can lower your risk. You have high blood pressure. High blood pressure can damage the tiny vessels in your eyes and reduce blood flow to the macula. You have high cholesterol or heart disease. You are diabetic. Studies show that the risk of future AMD development rises considerably in patients who have had diabetes for 5 years or longer. You skip regular eye exams. AMD often develops slowly and without obvious early symptoms, so a comprehensive eye exam is the best way to catch it early. You have a family history of macular degeneration or other eye diseases. You get little exercise and are overweight, or you spend a lot of time in the sun without eye protection. Keeping regular eye appointments gives you more treatment options if AMD is found early. Try not to delay your eye exams. There are two main types of AMD, dry and wet. Dry AMD is more common, accounting for about 70 to 90% of cases. It develops slowly as fatty deposits build up under the retina and the macula thins over time. Wet AMD is less common but more serious. Abnormal blood vessels grow beneath the retina and leak blood or fluid, which can lead to faster vision loss if not treated promptly. Most people are first diagnosed with dry age-related macular degenerative disease, or AMD, and some may later progress to the wet form. With dry AMD, many people still have fairly good central vision, such as 20/40 or better, but may have limitations. It progresses gradually, and healthy habits help reduce the risk of it advancing to the wet form. Early detections give you the best chance to slow AMD. Be alert for blurry, fuzzy, or hazy vision in the center of the image, double vision or missing letters or words when reading, difficulty recognizing a clock or a person's face, needing more light to read, vision that worsens at night, light sensitivity, blank spots that appear where parts of the eye's macula no longer work, eye flashes or floaters, eye pain or pressure, straight lines that may look wavy, inability to judge distance properly, making it easier to fall and difficulty walking, or sudden vision loss. If you notice any of these changes, contact your healthcare provider as soon as possible. Wet AMD is less common but can cause rapid, serious vision loss. In wet AMD, new blood vessels form under the retina and leak blood or fluid. Treatments such as eye injections and laser therapy may slow or limit your vision loss. Treatment for wet age-related macular degeneration is typically given on a regular schedule. As with any medical treatment, there are some risks, including eye infection, retinal detachment, changes in vision, and possible cataracts. For early dry AMD, healthy eating is an important part of treatment. A diet rich in antioxidants supports the cells of the macula. Try to eat more fruits, vegetables, whole grains, nuts, seeds, and herbs. Large studies called the age-related eye disease studies found that certain vitamins and minerals taken daily can slow the progression of AMD and may reduce the risk of late AMD by about 25%, according to the National Institute of Health. If your AMD is more advanced, your eye doctor may recommend specific supplements or vitamins with higher amounts of these nutrients. Regular eye exams are essential, but you can also monitor your vision with an Amsler Grid. This is a simple grid of straight lines with a black dot in the center that may detect changes in your central vision. How to use an Amsler Grid. Step 1. Put on your reading glasses, if you use them, and hold the grid 12 to 15 inches from your face in good light. Step 2. Cover one eye and focus on the center dot with the other eye. Step 3. While looking at the dot, notice the lines. Do any look wavy, blurry, missing, or dark? Are there any spots where the lines disappear? If so, contact your healthcare team right away. And step 4. Repeat the rest of the test with the other eye. If the grid lines ever appear different than usual, do not wait to see if your condition improved. Changes like this will not go away on their own. If your healthcare provider recommends an eye exam, the eye doctor will examine your eye's macula using several non-contact tools and scans. Think of it as taking a picture of your eyes with the light shining into them. These tests are simple, and many patients report being pain-free. The tests show your eye care team the surface and deep layers of your retina. Some of the tests they may use a visual acuity chart with letters, symbols, or shapes to measure how clearly you see. As we've learned previously, an Amsler Grid to check for distortion and track changes. Retinal imaging to take detailed pictures of the back of the eye, or pupil dilating drops to get a clearer view of your macula. Many patients report that the drops are painless. One common test is called OCT, which stands for Optical Coherence Tomography. This is a quick, non-invasive scan that uses light waves to create cross-sectional images of your retina. Nothing touches your eye and no needles or injections are used during the OCT scan. The images help your eye doctor see whether you have dry AMD, wet AMD, or another problem. While there is no cure for age-related macular degeneration, there are many ways to manage it by following medical advice and attending your healthcare appointments, which is vital for protecting your sight. Remember the ways to protect your eye health. Avoid using tobacco products. Try to eat less processed foods and more meals with fruits and vegetables. Stay on top of your conditions like high blood pressure, heart disease, and high cholesterol. Wear protective eyewear when possible. Be physically active. Increase your lighting when reading or performing intricate tasks, and report any vision changes promptly. If AMD progresses to later stages, your eye doctor may suggest treatments such as injections and laser treatment. Thank you for accessing this video on age-related macular degeneration. If you have any questions or concerns regarding your health, please contact your healthcare professional. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to explore more educational content in our Health Matters series.